Hey everybody, it's Pumill, and on today's Whiteboard Wednesday, we're going to talk about high blood pressure in pregnancy. This is a super complicated subject that's both shared between OB/GYN, high-risk OB, and cardiology at points. But I think it's an important topic to talk about because all of these risks increase when people get older. And I think that a lot of people at older ages are having children now, so this is becoming much more popular. Essential hypertension is essentially high blood pressure. Anybody can have it. The convention between gestational hypertension and hypertension is that when you were diagnosed. So anybody diagnosed with high blood pressure, which is generally 130 to 140 over 90, is less than 20-ish weeks, 20 to 22 weeks, we call it essential hypertension. Anybody can have it, male, female, anyone can have essential hypertension. Gestational hypertension is something we don't understand very well, but theoretically it's an interaction between mom, baby, and placenta. This is when blood pressure starts to go up above this goal at about 20 to 22 weeks. It becomes a spectrum. So now you start to think about preeclampsia. Preeclampsia is hypertension after about this amount of time, associated also, it's a little bit more severe features, so headache, blurry vision, protein in urine. So that is the most common thing that we see that really pushes us to the diagnosis of preeclampsia. And then on the furthest end of the spectrum is eclampsia, which is all of these things plus seizures. Both of these are essentially emergencies in pregnancy. The treatment when people are far enough on in pregnancy is delivery, urgent delivery. Once you start to get here and here, you start to treat them to help prevent down here. Some things become inevitable, but if you treat around this area, you can help prevent things from getting further along. In older pregnancies or twin pregnancies, IVF pregnancies, this spectrum becomes more common. The most common amount of evaluation is done by their OB and high-risk OB. However, sometimes if blood pressure starts to get elevated, we usually get involved to help with management, also another set of eyes, so we can see them a little bit more frequently along with the OB, so everybody's watching blood pressure. There'll be a few more videos down the line to talk about medications and treatment, but I just wanted to go over the overview of how we approach a pregnant patient with high blood pressure.